Yeah, just give me a call back at 690-1993 whenever you're ready to come in. And you can drop it off, leave it with us, whatever's most convenient for you. Look forward to seeing you at Sunrise Automotive.
Ocala's information station, 1370 WOCA. Ocala.
All right, 5 minutes after 11 o'clock. I'm getting a kick out of this list of recipes from kindergartners. Kindergartner named Krista said to make cookies, buy some dough and smash it and then cut them out. Then put them in the oven for 2 hours at 100 degrees. Then take them out and dry them off. Then it's time to eat them.
Oh, how fun.
Here's one. Mariah said to make a turkey, first cut out the bones. Then you put it in the oven for 10 hours at 600 degrees. Then you put it on the table and eat it. You know, we have Dr. Christine Horner on the phone, and she has always been our go-to person when it comes to eating right and being healthy. She's a preventative, do I say that right? Preventative health expert, a surgeon, a speaker. She's on our show quite frequently, actually. I think the first time she came on was about the book Waking the Warrior Goddess, which I'm still trying to wake the Warrior Goddess. And she's going to talk to us about 4 disease conditions that modern medicine provides few answers to. Wow, that's interesting. Dr. Horner, good morning. Christine, how are you?
I'm great. How are you doing?
I'm okay. I'm getting a kick out of these recipes from kindergartners, though.
I was, too. I thought, gosh, there's people that are worse cooks than I am.
Yeah, but they're only 5 years old.
Right.
Are you in California?
I am. I'm in beautiful San Diego.
Oh, yeah. Beautiful place, right?
Yes, it is.
So we have some conditions that there are few answers to?
Yeah, so one of them, these are kind of hush-hush things people don't like to talk about, but, sexually transmitted diseases like the HPV virus, which is the most common one. There's all this talk about, getting our kids vaccinated at a super young age because, this particular virus can lead to cervical cancer. And the good news is that it actually goes away on its own if you get infected 98% of the time. So it really is only an issue for about 2% of people, and mostly that's folks that, there's something going on with their immune system, where it's not strong enough for a variety of different reasons. But once you get that chronic infection, there's actually no Western treatment that's effective in getting rid of it. But the great news is that there's new research that's out of the University of Texas Health Sciences on a mushroom formula that was tested against the HPV virus. Is called AHCC, stands for active hexose correlated compound, which is why we call it AHCC. But they tested it against the HPV virus, found that it killed it, and then they tried it in women with a chronic HPV infection, and they found that everyone who took it for longer than 6 months, it completely went away.
Oh,
so
wow.
now they're doing this huge clinical trial, on it. And I mean, this is like super exciting news because, like I said, there's no Western treatment, that's effective for it. And here you got a simple mushroom formula with no horrible side effects, that can get rid of it. Yeah.
Do you know, one of the things I always wonder about is when we have, and you've told us about a few different natural things, just foods or things we can do. I often wonder if there's resistance from the people who make money from pharmaceuticals. Is there resistance?
Of course there is.
There is. Okay.
Of course there is. That's right. Unfortunately, Western doctors really aren't, trained in it. Another example is depression. When I was working as a plastic surgeon, I bet you half my patients, were on antidepressants. So it's kind of like, in the past we used to put everybody on Valium, and now they put everybody on antidepressants. And the problem is that, they have horrible side effects, to them. And so what the research shows is that there's a lot of natural things that you can do that are just as effective, if not more so. And exercising, is one of them. So, doing aerobic exercise, they found is just as effective as medications. And then vitamin D, which is a, common thing that people are low in. Lots and lots of research on that in the last, decade or so, showing it acts like a hormone and really is essential for all the functions in our cells. But they've also found that vitamin D levels are low vitamin D levels are associated with depression, and there's a number of studies where they gave supplemental vitamin D to people, and their depression got better. So
maybe that's why depression starts with a D. Maybe there's a connection there. So
yeah, maybe.
So you're in San Diego. We're in Florida. We've got a lot of sunlight. I thought the sun was. I thought we got vitamin D. So you would think that people in the South would be happier simply because there's more sunshine.
And they are. You should, San Diego, everyone's smiling and happy out here. But, one of the things is that it depends on the season. In the wintertime, we still don't get enough rays to get adequate amounts. You have to have all your skin exposed to it. And obviously in northern, cultures in the wintertime, that is not going to happen. So the only way that you know how much you should be taking is actually by getting your vitamin D levels checked. And you don't even have to go to a doctor's office for that. You can order a kit from an internet site called powerofd.org, and they send the kit to your house. They have instructions. Basically, you're just putting a dot of blood on the piece of paper and sending it in, and then they'll tell you what your vitamin D levels are, and then you can get them rechecked in about 6 months. So that way, you up the amount that you're taking, and you figure out, okay, am I at the right amount, or do I need to take more? But yeah.
Oh, I have a question for you about beets, because in 2 days we're going to Thanksgiving dinner, and beets always shows up at the Thanksgiving table, and I never eat it. I never ever eat it. And somebody told me, actually I heard it on the radio, so I was told by a radio host, but that it was really good for me. What is your take on beets?
Yeah, so, beets, anytime you look at a vegetable that naturally has a huge amount of pigment in it, like that bright, red color that stains everything. Or in turmeric, that bright yellow-orange color that stains everything, that gives you a clue of how much antioxidants, are in it. So beets have huge amounts of antioxidants in it, and they very specifically are known to help the liver to detoxify. So they're great when you're doing detoxes in particular. But yeah, very, very beneficial, healthy for you.
And so antioxidants, what? And I know you would think that doing radio shows about this kind of stuff a lot, it would have sunk in by now. But what exactly does an antioxidant do?
Sure. So we have in our bodies two things that have a lot of purposes, which include oxygen-free radicals and inflammation. So they have a lot of functions in our body. However, what happens if we have too many oxygen-free radicals, and those are molecules of oxygen that are lacking an electron. And so they actually are used to drive all the chemical reactions in the body. But if you have too many of them, they start stealing electrons from your DNA and your cell membranes and cause a lot of damage to your body. And inflammation, similarly, causes a lot of damage. So now we recognize that oxygen-free radicals and inflammation are the two processes that are involved in every chronic disease and aging, and accelerated aging. So by neutralizing them, and that's what an antioxidant does, it donates that electron to the oxygen-free radical and binds it up so that it won't damage your cell membranes and DNA.
See, this is why I never remember this stuff. I'll never remember all that. So I just have to say antioxidants are good, and get bright-colored vegetables, and I'll be fine, right?
Yeah, that's a good rule of thumb.
And does it matter if they're heated or cold? Are the antioxidants more plentiful in one way of serving than the other?
Well, it depends on what you're consuming. So it actually varies from plant to plant. So, for instance, with artichokes, you have to cook artichokes, right? But they found that by cooking artichokes, you get 15 times more of the antioxidants when you cook it. Other things, if you overcook it, it kills the antioxidants in it. So it actually is pretty specific, based on what the particular plant is. But I would say in general, what they found is if you lightly cook, and this is an old Ayurvedic recommendation, you lightly cook your vegetables so you're not overcooking them, it actually causes kind of the first portion of digestion and allows you to absorb more nutrients in it.
I took you on a little bit of a tangent there. My notes say that you also want to talk about the natural medicine game changers that can help reverse the diagnoses of the four disease conditions we started to talk about earlier.
Yeah, so we talked about the AHCC, which is effective for the HPV virus, for depression. Vitamin D is, and also doing exercise are great things. Breast cancer, I'm an expert in that area, and we found that diet and lifestyle, and actually taking certain supplements, can drastically lower your risk of developing breast cancer. Turmeric, which I just mentioned, that bright yellow-orange color in curry. It's got almost 10,000 studies in the medical research now. It's the most studied plant, and it's considered the #1 anti-cancer spice, and has about 30 different anti-cancer effects to it. And then also vitamin D can cut your risk in half. I mean, they've got studies showing that when people are low in vitamin D and they supplement them with vitamin D, it cuts the risk of breast, prostate, and colon cancer in half. Again, how simple is that?
Yeah.
AHCC, the mushroom formula, is got great anti-cancer effects. Again, not just for breast cancer, but prostate, liver cancer, melanomas. It's known for omega-3 fatty acids are another super critical thing for everyone to take, I think, every day, because the health benefits are so tremendous. And it's got huge anti-inflammatory properties, so it lowers virtually every kind of chronic disease, improves depression, lowers the risk of breast cancer. I mean,
Oh,
you can
my
just go,
goodness.
yeah.
Well, that's that should be a New Year's resolution to eat healthier, and we'll be happier. Dr. Christine Horner, always good to hear from you. Your website is?
drchristineHorner.com. So it's drchristineHorner.com.
All right. Have a great Thanksgiving, and you're welcome back anytime. Thank you for being on the show.
Thanks. Oh, you're welcome.
And thank you. And we will be right back. This is WOCA.
The weather is brought to you by myfwc.com. Safe boating is no accident. On this Tuesday, sunshine.